Hi, my name is Siobhan Hall, and I will be talking to you guys about COPD exacerbation. We will talk about what COPD is. We will be discussing how it is diagnosed. We will be discussing briefly about the diagnostics tests that help determine what COPD is. We'll talk about some patient education, and we'll also talk about prevention. So you want to know what COPD exacerbation is. So what COPD is chronic obstruction pulmonary disease. And the exacerbation is pretty much just worsening of the symptoms that a person has with this disease. And worsening symptoms could include like a cough, you start to have shortness of breath, you're feeling restless, you're having like these cold symptoms, or sick symptoms. You're starting to feel sick, and your body is going to give you signs and symptoms on what is about to be an exacerbation or a flare up. So people use these two terms interchangeably. So also with COPD, it causes damage to your lungs or other parts of your airway or your lungs. It's also a progressive disease, which means that it starts off and then it develops slowly over time, especially if it's not managed or especially if a patient is being that's not adherent to their treatments. COPD is a common treatable preventable condition. So if the person avoids certain lifestyle changes, this uh, disease or this condition could be preventable. You want to know, how is COPD diagnosed? One test that is indefinite that could diagnose a person with COPD is called a spirometry. So this is a lung function test. This test measures how much air a person can forcefully inhale and how quickly they can do it. And let me tell you, I took this test before and it is a very hard thing to do. Another test or diagnostic tool that is used is a chest x-ray. So this doesn't necessarily diagnose you as having COPD, but it can definitely rule out if you have any other lung conditions that are present, like pneumonia. Another test that we use it's a blood test and it's called ABGs. This is going to measure your blood gas. So the ABG stands for arterial blood gas. And all it does is just measure the oxygen and the carbon dioxide that is in a person's blood. Another test could be like a pulse ox you can place on the person's finger. And if their oxygen levels are usually low and they're having a hard time breathing, you're hearing that wheezing, any signs of just difficulty breathing, labored breathing, a person may have COPD. Show a patient education video on COPD. It is very important to understand how your patient is receptive to learning. If that is reading a pamphlet, if it is watching a video, if it is having something being demonstrated to them, it's very important to know how your patient is going to understand and comprehend that education that you are giving them, because it plays a key role into medication adherence and prevention. So one of the most important things to do is prevent these exacerbations from happening. It is very important that you avoid exposures and irritants. This is the most common and easiest thing you can do as a patient if you have COPD. Avoiding these exposures, which could be cigarette smoke. If you live in an area that has like high traffic, a lot of air pollution, a lot of construction, you want to avoid those areas, or you want to just relocate. Even animals, like if you have animals and if you have like a lot of allergies, you want to avoid these things. If you are a smoker, quit smoking. Do not smoke. That is just a terrible thing to do. And I think as a provider, we have to be very upfront with our patients. This is not going to make anything better. So if you are a smoker, please, please, please quit smoking. It is also important if you are an older adult to stay up to date with your vaccines, whether it's the flu vaccine or the pneumonia vaccine. It is also important to take all your prescribed medications. Very, very important to prevent those exacerbations and also to um, just maintain your medication regimen. Another thing to do is to maintain a healthy lifestyle that is consisting of eating a healthy diet, exercising, but also taking those rest periods. If you know that you're COPD, that you can only maybe exercise or do an extraneous activity for 5 minutes, then just do it for 2.5 minutes and give yourself a break and then finish out another 2 minutes. Give yourself good periods of resting and also monitor your symptoms. If you start to feel off, like I said in the previous slide, your body is going to give you signs and symptoms on when a flare up or exacerbation is about to happen. So make sure that you are paying attention to your body. And that is one of the ways that you can prevent an exacerbation, and also you can prevent hospitalization.